Hello and welcome. Today, we're diving into the world of eye health to explore a common, yet often misunderstood condition, chlamydial conjunctivitis, also known as inclusion conjunctivitis. So, what causes this infection? Chlamydial conjunctivitis is primarily caused by the bacteria Chlamydia trachomatis. While often associated with sexually transmitted infections, this bacteria can also infect the eyes. Transmission occurs when the bacteria comes into direct contact with the conjunctiva, the clear membrane that covers the white part of the eye and the inside of the eyelids. This can happen through hand-to-eye contact, contaminated towels, or from mother to newborn during childbirth if the mother has a chlamydial infection. Let's delve into the pathophysiology. Once the Chlamydia trachomatis bacteria enter the conjunctiva, they infect the cells lining this membrane. This triggers an inflammatory response, leading to the characteristic symptoms of conjunctivitis. The bacteria reproduce within these cells, causing further damage and inflammation. The immune system attempts to fight off the infection, contributing to the swelling, redness, and discharge associated with the condition. Unlike some other forms of conjunctivitis, chlamydial infections can also lead to the formation of follicles, small bumps on the conjunctiva. Now, regarding epidemiology. Chlamydial conjunctivitis is often linked to sexually active individuals, particularly those between the ages of 18 and 30. It is more prevalent in populations with higher rates of sexually transmitted infections. Newborns are also at risk if their mothers have untreated chlamydial infections. The exact incidence varies depending on location and access to health care, but it's a significant cause of conjunctivitis worldwide. What are the telltale signs and symptoms? Chlamydial conjunctivitis typically presents with redness in the eye, a gritty or burning sensation, and excessive tearing. A hallmark symptom is a thick, purulent discharge. Unlike viral conjunctivitis, which often affects both eyes simultaneously, chlamydial conjunctivitis often starts in one eye and can spread to the other. You might also notice swelling of the eyelids, blurred vision, and sensitivity to light. As mentioned earlier, the presence of follicles on the conjunctiva is a key diagnostic clue. How is chlamydial conjunctivitis diagnosed? Diagnosis typically involves a thorough eye examination by an ophthalmologist or optometrist. The presence of follicles is a suggestive sign. However, definitive diagnosis requires laboratory testing. This can include taking a swab of the conjunctiva and sending it for PCR testing to detect the Chlamydia trachomatis DNA, or through cell culture techniques. These tests help differentiate chlamydial conjunctivitis from other types of conjunctivitis, ensuring accurate treatment. While classifications aren't strictly applied to chlamydial conjunctivitis, it is important to distinguish it from other forms of conjunctivitis based on its cause. This differentiation guides the choice of appropriate treatment, as antibiotics are specifically needed for chlamydial infections and would not be effective against viral or allergic conjunctivitis. Treatment for chlamydial conjunctivitis involves antibiotics. Oral antibiotics, such as azithromycin or doxycycline, are typically prescribed. In some cases, topical antibiotic eye drops may also be used. It's crucial to complete the entire course of antibiotics, even if symptoms improve, to completely eradicate the infection and prevent recurrence. Importantly, because chlamydial conjunctivitis is often linked to sexually transmitted infections, sexual partners should also be tested and treated to prevent reinfection. Good hygiene practices, such as frequent hand washing and avoiding sharing towels, are also important during treatment. Prevention is key to controlling the spread of chlamydial conjunctivitis. Practicing safe sex, including consistent condom use, is essential. Pregnant women should be screened for chlamydial infections and treated if necessary to prevent transmission to their newborns. Good hygiene practices, like washing hands frequently and avoiding touching your eyes, can also help prevent infection. Avoid sharing towels, washcloths, and eye makeup to minimize the risk of spreading the bacteria. What's the prognosis? With prompt diagnosis and appropriate antibiotic treatment, the prognosis for chlamydial conjunctivitis is generally excellent. Most individuals fully recover without any long-term complications. However, if left untreated, the infection can persist and potentially lead to scarring of the cornea or chronic conjunctivitis. Recent research focuses on improving diagnostic methods for faster and more accurate detection. Researchers are also exploring new antibiotic regimens to combat potential antibiotic resistance in Chlamydia trachomatis. Understanding the epidemiology and transmission routes remains crucial for effective prevention and control efforts.